This one?
Is it yours?
No, it's not mine. It's yours? Sure? Good. Okay. All right. When we are saying the renal blood flow, are we talking about the whole blood which is coming to the kidney, or we are specifically talking about the plasma or one part of the blood? Whole blood. Okay. Now that blood contains plasma also and cells also. You also know one thing, plasma is only filtered and the cells are not filtered. So now you will focus the plasma. You are starting from the cardiac output, you are looking at the renal blood flow, and then from the renal blood flow you are now looking at the renal plasma flow. Okay? How much is the plasma flow coming in the renal blood? How much is the quantity of the plasma? It's about 650 ml or so. Okay, more than 600 ml. Usually 625, 650 ml is there approximately. Okay, so out of 1100 ml blood, that contains about 650 ml of the plasma. Now your focus for filtration is plasma. Plasma is filtered, the whole blood is not filtered, you know that. Okay, and from that plasma which is coming, out of that plasma, how much part of the plasma is filtered, or how much volume of the plasma is filtered? What do you think? So out of that 650, how much is filtered? 125. So 125 out of 650 is filtered. Okay. If you are saying 125 out of 650, approximately how much percentage you are talking about? 20% takriban. Okay. It's 20%. So all the time your GFR is the 20% of your plasma which is coming in the kidneys. Okay. So if I ask you, make a relationship between the GFR and the renal plasma flow, you will say okay, the GFR is 1/5 or 20% of the total renal plasma flow, or renal plasma flow is 5 times that of the GFR. In both ways you can say, there is no problem. There is a word written here. Can you see that word? FF. Okay, but no meaning, no detail, no elaboration. Okay, yeah, fraction. Okay, filtration fraction. F for filtration, F for fraction. What do you mean by filtration fraction? You are looking at the renal plasma flow, you are looking at the GFR, and in between these two you are using a word, filtration fraction. What do you mean by that word? Yeah, filtration fraction is actually another way of looking at the GFR. What fraction of the renal plasma flow is becoming the GFR? How much fraction? What is the fraction? You will say 1/5, 1/5, isn't it? So filtration fraction is 1/5 normally, or you can say in terms of percentage it is 20%. If you change it to percentage, 20%. Now we are sure 1/5 of the plasma is filtered. Okay, and that is called filtration fraction. In terms of percentage, it is equal to 20%. So you can say 1/5 or you can say 20%. It's the same thing. Okay. So filtration fraction is basically the ratio. Okay. If you write GFR and you divide the GFR by renal plasma flow, so 125 divided by 650. This is the ratio, and that is giving you 1/5. Okay, and 1/5 means 20%. So filtration fraction is 1/5 or 20%. This is simple. All right? Is that clear to all of us? Okay. All right. Now please, few special things, very interesting, but be careful. The filtration, the GFR, glomerular filtration rate, which is 125 ml per minute, okay, is mainly determined by two special factors, or the two special determinants. One determinant is called the filtration coefficient, okay, and the other one, filtration coefficient, is written by KF. We say KF. It means filtration coefficient. We'll talk about that. And the second one is filtration pressure. In two determinants are working in area, and these two determinants are producing the GFR or the filtration. Okay, one is Kf, filtration coefficient, and the second one is filtration pressure. Okay, filtration pressure is easy. It's coming in mind some kind of pressure which is causing filtration. Okay, that's filtration pressure. That's simple. But filtration coefficient is not clear really. What is the meaning of filtration coefficient? Okay, how do we get that? Let's see. Okay, now you see. Shabab, please try to get the concept of filtration coefficient, all of you. Filtration coefficient, please, is a product of two things. You are looking at the glomerulus, okay? Because filtration is happening to the glomerulus. Now, what are you looking at when you are talking about the filtration coefficient? Two things, please. Number one is the surface area of the capillaries. You know, capillaries are pipes, and each pipe is a surface area, okay? Like, this is a page. If I turn it like this page will become a capillary, isn't it? But if I open up, this is the surface area of the capillary. There are many capillaries in the glomerulus, so glomerulus has a surface area, okay? Do you think the filtration will depend on the surface area? Yes or no? Yes. If you have more surface area or good surface area, good filtration. If you have less surface area, less filtration. So one factor is the surface area, okay? Second factor is the permeability, okay? How many pores are present, how many permeable areas are there in the capillary, okay? Now if this is a capillary, okay, you can see the holes here. Can you see the holes, small holes here in the page? If many holes are present here, okay, the fluid will pass through these holes. This is called the permeability, okay, passing through the pores, okay? If there are, look at this one please. Many pores are present here at the base, all right? If all the pores are open, what will happen to the permeability, good or bad? But if I close half of the pores, what will happen to the permeability? Less, it will become half also, isn't it? So it means your filtration is dependent on two factors, how much surface area and how many holes are present in the permeability, okay? If you multiply these two things, you will get the filtration coefficient. Now you get the meaning? Okay, so filtration coefficient is made by two things, permeability and surface area of the capillaries. Now Shabab, there are many diseases of the kidney which can destroy the glomerular capillaries. If you are destroying the whole capillaries, you are losing the surface area and the permeability factor is also affected, isn't it? If you are having the normal number of capillaries, but there is some process of fibrosis going on in the membrane and fibrosis is developing, what will happen? Surface area or the permeability? Fibrosis is going in the basement membrane, for example, only, okay? The size of the capillary is there. Capillaries are majood, blood is coming in the capillary, but there is problem in the basement membrane, fibers are there and the gaps are decreasing in size, okay? So mainly what will be affected? Permeability. So some of the diseases can change the permeability and some of the diseases can change the surface area and some of the diseases can change both, okay? Obviously. So if there is a disease which is changing the permeability and surface area, what will happen to the GFR? Decrease, okay? So these are the main factors. So if I ask you, please give me the two main determinants of the GFR on which the GFR depends, you will say coefficient, no, not right now, coefficient and the pressure, right? Leave the pressure. What are the two main things which are making up the coefficient now? Surface area and the permeability, okay? And now you will multiply it by the pressure and that's it, okay? All right. This is the filtration coefficient value, 12.5 ml per minute per millimeter of mercury, okay, per the pressure. This is the value of the coefficient which we have calculated. All right. Please look, in histology, have you seen this diagram? A special cell is shown here. Can you identify the cell in this diagram? Oh, no, between the two capillaries, there is kind of a cell which is fitting in between the two capillaries. Can you see this cell? Yeah, there is a cell between this is one capillary, this is another capillary, and there is a cell in between. What is that cell known as? Any idea about this cell? No idea about this cell. Good, no problem. Okay, so we will discuss that very quickly. Mesangial cells are very special cells and shape changing cells. Okay, they can become a little relaxed and big in size, and they can change their shape by contraction. These are contractile cells and they can change the shape. Look at their position. Okay, when they relax, okay, when they relax, they will become like this, and they will become flattened in this position. When they contract, if they contract, they will become like this, and they will go in this direction. Okay, the shape will change. Now, answer my question. This is the relaxed mesangial cell here shown. Okay, you can see the lumen of the capillaries. Okay, good or bad lumen? Good. Okay, it's open. If I contract this cell, it changes the shape. What will happen to the lumen of the capillaries? Narrow, a little narrow. Okay, so the space of the lumen will decrease, isn't it? So it means if I contract the mesangial cell, what will happen to the blood flow in the glomerular capillaries? Increase or decrease? The capillary lumen is decreased now a little. Okay, the size is decreased. Okay, if I change the shape, again I am changing it. Okay, if I make it like this, so it will go in this direction, it will project here and here. So what will happen to the capillary lumen? What will happen to the amount of blood which is going in this area? Also decrease, isn't it? Okay, so contraction of the mesangial cell will decrease the blood flow or increase the blood flow? Decrease. So what will it do if the blood flow is decreased? What will happen to the GFR? What do you think? It will also decrease, because GFR is coming from the blood. If you are bringing less blood into this area, what will happen to the filtration also? It will decrease. Okay, so mesangial cell position is also affecting it. Okay, remember that. Some special chemicals or hormones, they can change the shape of the mesangial cells. If a hormone is relaxing the mesangial cell, will it increase the GFR or decrease the GFR? And if a hormone or a substance is causing tightness or contraction of the mesangial cell, what will eventually happen to the GFR? Slight change or decrease in the GFR. Okay, all right. Okay, so surface area changes by the available surface area for filtration changes when, okay, all right. Permeability we know. Now please, filtration pressure. We are just approaching towards the end. Okay, filtration pressure. The pressure which is causing the filtration, okay, this pressure is a very special pressure which we determine by different forces. Okay, it is the net pressure. It means different forces are acting in the region, and the result of those forces will give you a special pressure, and that pressure is known as filtration pressure. What is the value written here? 10. It's 10 approximately. We'll see how and why it is 10. Okay, let's have a look, quick look please. Now that's very, very easy and very, very understandable diagram. Okay, look at this diagram, Shabab. Okay, we are in the last minutes of the discussion, but look at the diagram please, all of you. It's a diagram of the area of the glomerulus and the Bowman's capsule given there. Can you see? Okay, not the true diagram, but a representative diagram. Okay, and some values are written in the diagram also. Okay, please try to locate. Can you identify the afferent arteriole and the glomerulus area and the efferent arteriole in the diagram? Yes. You can? Okay. Yeah, definitely. Okay, all the forces are acting, and we'll see how are they fighting with each other and what are they doing. Okay. Can you see the Bowman's capsule also? Yes. Okay, now first you look and focus at the glomerulus and the afferent arteriole. Okay. Blood is coming in that area. Do you think blood has some pressure? Yes or no? Yes. These are capillaries, glomerular capillaries. So you call this pressure as glomerular capillary pressure, all right? It's the blood pressure, the pressure of the blood on the walls of the capillaries, all right? You call it glomerular capillary pressure, GCP, or the capillary pressure, okay? How much is the value of this pressure? 60. Out of all the values written, which value is the highest value? It's 60, right? 60 is the highest value which is written here. So glomerular capillary pressure is by far the largest pressure here. You can see that. It is the pressure of the blood. Bas, khalas. In the blood, there is another pressure present which is written here. Can you identify that pressure? Oncotic pressure. I'm sure you are familiar with the word oncotic. From proteins, isn't it? Plasma proteins, okay? A very special pressure, okay? So two pressures are present in the blood. Now you come down and look at the Bowman's capsule. Do you see any pressure there? What is that pressure? It's the Bowman's capsular pressure. Do you agree with me that all the time there is some fluid present in the Bowman's capsule? Fluid, the filtered fluid is there. If some filtered fluid is there, it will have some pressure on the walls also. That pressure is called the Bowman's capsular pressure because filtrate is موجود there, right? Okay. So altogether, how many pressures do you see in this picture? Three. Out of these three, two are present in the capillary or in the blood. And one is present in the Bowman's capsule. Agreed? Okay. Now, look at the role of these pressure. The first pressure, please. Glomerular capillary pressure. It is the pressure on the walls of the capillaries, glomerular capillaries. Will it help filtration or will it oppose filtration? What do you think? It is the helping pressure and it is the greatest pressure, isn't it? So 60 pressure is trying to cause filtration. We all agree with that. Look at the second pressure. It's the plasma colloid osmotic pressure or the oncotic pressure of the proteins. What is the value written there? It's 32, which is written there. All right? Yeah. Do you think this pressure is also pushing the fluid or it's opposite? It is trying to retain, because where proteins are there, they try to retain the water molecules with them. Okay? So this pressure is against the filtration. So in the blood there are two pressures. One is causing filtration, but other is opposing filtration. Which one is greater out of these two? Definitely 60 is greater, right? Now you go down and look at the Bowman's capsular pressure. Okay? This is the area of the Bowman's, this is the space of the Bowman's capsule, for example. And this is the filtration membrane. Okay? Some fluid is present here. If this fluid is present here and this fluid is working here on this wall here, on those areas. So this fluid, if it is acting in this direction, is it trying to help filtration or oppose filtration? What do you think? Okay. Now calculate how many pressures are the opposing pressures? 2. And how many favoring? Just 1. Now you add the opposing pressures. It's 50. Now you look at the favoring pressure. Now you see the difference of these two pressures. In which direction? Filtration direction or opposing direction? All right. So this difference of 10 mmHg is called the filtration pressure. Okay. Now this is the 10 where we are getting from. Yani three forces are acting. Look at these three forces. Okay. So your glomerular filtration is the interplay of these forces. If any of these forces change, your glomerular filtration rate will change definitely. If one is increasing, it will affect the other. Okay? If the other is increasing, it will affect the glomerular filtration rate. If your capillary pressure is increasing and the other two are same, what will happen to your GFR? Increased. Okay? If your plasma colloid osmotic pressure is increasing and the other two are same, what will happen? If your glomerular capillary pressure is somehow increased and the other two are almost same, what will happen to the total filtration? Decrease. So now you can look from different angles which force is doing what, and you can easily get the answer. Is it clear so far? No problem? Okay. Yeah, so far means we are finishing. All right. It is the same thing. I am leaving it for you. How do you calculate the GFR, filtration coefficient and net? I gave you the value of filtration coefficient, I gave you the value of filtration pressure, you just multiply, you will get the value of the GFR, 125 ml per minute. Alright? Done. Okay? And thank you. That's why so far was very close.